Hi, I'm a nurse in the Treasure Valley. I've been a nurse for almost 30 years. I've worked at the hospital that I currently work at for 21 years. Maybe getting a pink slip soon because I don't want to take the vaccine. My concerns are for people like the gal outside that I just spoke with who has to remain anonymous. Her husband has stage 4 cancer, so she carries the insurance. She's a nurse at one of our hospitals. And if she loses her job, he doesn't have health insurance. Another concern is it is still experimental. mRNA vaccines there have never been licensed. They're still not licensed. It was released as an emergency measure. Are we in an emergency? That's a good question. My hospital has over 300 beds. On Tuesday, I asked the health supervisor what the COVID numbers are. Two. Is that an emergency? Why are we suddenly being forced to get vaccinated? If I'm a risk to the patients, they've been vaccinated, how does that make them a risk? They're immune from it, right? So how can I be a risk towards the patients? I wear a mask, I wash my hands, I wear the gloves like I'm supposed to. I'd like to know what that risk is. I'd also like to know what the risk is and what the numbers are that support any evidence of nosocomial infections, which would be hospital staff passing it to the patients. What are the numbers? Does anybody have any statistics on how many healthcare providers have actually given a patient COVID?